Patients over 45 frequently invest in advanced treatments like PRP or exosomes, only to find the results don't match the significant financial and time commitment. Often, younger patients undergoing these exact same procedures see much more rapid and visible improvements. This discrepancy isn't usually a failure of the technology or the practitioner, but a reflection of the patient's internal cellular substrate. Cellular regeneration cannot take hold in a biological environment that is actively working to suppress it. To find the source of this suppression, we look at where the biological bottleneck occurs within the tissue. This comparison shows healthy, functioning cells alongside a senescent cell. As we age, some cells stop dividing and functioning, but remain in the body instead of being cleared away. These dysfunctional cells accumulate in clusters within the skin and connective tissues. These clusters release a steady stream of inflammatory signals that physically degrade the collagen and the structural framework of the skin. This chronic inflammation acts as a biological shield, deflecting the healing signals that regenerative treatments rely on to be effective. This accumulation of cellular debris creates a localized environment that actively resists aesthetic and medical interventions. Our clinical approach must begin by actively clearing this biological bottleneck from the tissue, long before we ever attempt to stimulate Ning cellular growth. During phase 1, we use senolysis. Watch these compounds navigate the cellular matrix, locking on to senescent cells while bypassing healthy ones. Administered in short pulses, they dissolve damaged cells and flush out inflammatory debris, perfectly clearing the area without constant systemic exposure. Systematically removing these cells restores a pristine baseline environment, ensuring that subsequent treatments can actually reach their intended biological targets. In weeks 2 and 3, the protocol shifts from the clearance of damaged cells to the active support of the remaining tissue. We use targeted nutraceuticals to physically reduce any residual inflammation left over from the initial cellular clearance. This targeted biological support encourages the surrounding local tissue to actively shift out of inflammation and enter a highly receptive state of repair and remodeling. By the end of this phase, the tissue is biologically prepared to respond directly to incoming regenerative signals. At weeks 3 and 4, we introduce the primary regenerative procedure, such as biostimulators, PRP, or exosomes. As the diagram shows, delivering these treatments into a cleaned environment allows the signals to integrate rapidly rather than being blocked by cellular clutter. Without the inflammatory blockades in the way, we see a measurable increase in collagen production and cellular growth. Through weeks 4 to 8, we sustain this progress with mitochondrial support and peptides, providing the building blocks necessary for the body to maintain the new tissue. The procedure achieves a different outcome because it no longer has to compete with cellular interference. This protocol represents a science-driven approach to aesthetics and tissue regeneration. Ultimately, effective rejuvenation depends on the biological discipline of preparing the cellular environment before starting the rebuilding process. Addressing the cellular environment first ensures that regenerative treatments reach their full biological potential.